All right, good evening. Welcome to the Exercises Medicine Wellness webinar. My name is Kelly Urs, and I am an exercise physiologist and wellness program coordinator for the Exercises Medicine program. I have the pleasure of introducing to you tonight Melissa Gallatin, who is a physical therapist at the Outpatient Care New Albany facility, specifically working in orthopedic rehab. She's going to talk with us tonight about strength training and exercising with osteoporosis and lifting away the pain. I love that title. So Melissa, I'll let you take it away. Any questions, please put them in the chat feature and we'll address those as we go. So Melissa, thank you for joining us and sharing your expertise.
Thank you, Kelly. All right, well, good afternoon, everyone. So like Kelly said, my name is Melissa Gallatin. I'm a physical therapist at our outpatient care facility in New Albany and specialize in orthopedics. In particular, I work with the endurance athlete. So I'm our endurance athlete team lead. So I specialize in treating runners, swimmers, cyclists, triathletes. So definitely very passionate about getting people active and exercising. I think it's very important to live a long, healthy, safe life. So I'm going to be discussing today kind of lifting away the pain. So the importance of not only exercise, but strength training, as some people will tend to kind of steer away from strength training as they don't think that that's for them. But hopefully by the end of this talk, you'll see why it's so important. So a lot of times when people think about strength training, you think that it's people that they're getting ready for, like, the Arnold Classic. So we're getting ready for next spring. We're trying to get big and bulky. And that's not the strength training I'm talking about. I'm looking at more kind of toning the muscles and in order to help protect our joints. So my objectives are going to be kind of going over how important strength training is, and then going over some of the exercises that would be a very basic program for you. So what can we do to improve our joint health? Because that definitely, I remember my grandmother, she had some pretty severe arthritis in her knees, and it definitely limited her quality of life as she got older. And so very important to, stay active. It's actually the International Osteoarthritis Research Society has deemed rehab or physical activity as a core treatment for osteoarthritis. So keeping moving is very, very important for your joint health. In physical activity, there's kind of different buckets. You've got your aerobic exercises, your range of motion or flexibility, kind of included in that would be yoga. And then also the strengthening exercises, like I said, that I will be going over. With our aerobic exercises, the recommendation is 30 minutes of moderate exercise, 5 days per week. And there's a wide variety of aerobic exercises. There's running, there's walking, there's swimming and cycling, and so on and so forth. With those, as we get older, our joint health can tend to decline, and that's very normal. It's part of the aging process. So the recommendations for individuals with, maybe some arthritis, early onset arthritis, is looking more into those lower impact activities. So looking at more of your walking, your cycling, swimming, even elliptical would be a great way to exercise, to just keep lower impact, less joint forces, to kind of irritate or aggravate the joints. My kind of thing that I'll tell a lot of my patients is, you may not enjoy aerobic exercise, but I always say, and sometimes they'll, I'm a big runner. I love to run, and all my patients, oh my gosh, you're going to have, knee arthritis. And there is no research to say that just because you run, that leads to arthritis. Now in moderation is more where you want to look. But I explained to a patient that I'm going to keep active. That's my activity that I love to do. There's much less, so as you're active and, keeping good cardiorespiratory health, you're also working on that heart health. And I always say, I'm not going to die because of some knee issues or some knee pain, but I will if with a heart issue. So that's why I recommend, aerobic exercise is definitely a very important kind of part of a healthy lifestyle. Next in the bucket here is going to be our range of motion and flexibility. So when I talk to my patients about their joint health and how the flexibility of a joint or motion of a joint is very important. So our joints move certain ways. So they'll kind of, I always explain there's kind of a rolling and a gliding of joints. And if we have muscles that are tight, that can affect those joint mechanics, which then can lead to earlier kind of breakdown or degradation of the joint. So the flexibility and movement of the joint is very important as well. And then lastly, the strengthening. And this one, like I said, people tend to be very fearful that, oh, I've got arthritis. I don't want to lift weights that, it's going to make it worse. And my explanation for them is, we have our joints, which is kind of the bony part, that allows our joints to move. Our muscles are what make the movement occur, but our muscles also are very important in absorbing shock. So if we, and I'll talk about this in later slides, how as we get older, muscle strength and mass declines. So I tend to look at the knee because it's probably the most common area that we see patients with arthritis. So as we're walking, as we plant on the floor, our quad muscle in particular is a very important muscle to absorb forces or shock. As we get older, that strength declines. Those muscles aren't there to absorb the shock. And now it's the joint that takes the forces. So that's why I explained, it's so important. Yes, I'm not going to cure arthritis. I'm not going to get rid of your arthritis. We're trying to slow that rate down. And by building the muscles around the knee joint, it will take the force off the joint and into the muscle. So what is strength training? So the definition of strength training is going to be an activity that involves the performance of physical exercises that are designed to build muscle and improve strength. And it's often associated with some type of weights or resistance, but you also can use body weight. Some examples of what can be used for weights are dumbbells, there's kettlebells, resistance bands, medicine balls, there's ankle weights, there's if you're going to do a bench press, you can use a weighted bar and put plates on it. So lots of different things that you can use, but don't even have to. I mean, some of my patients don't have access to weights, and I'll tell them, hey, take a backpack and put some, put a thing of flour in there, and you can do some calf raises, and that adds some resistance there. So yes, there are, certain things that have, that are titled weights, but you can make your own at home as well. So this is the slide that I was telling you about what happens as we age. So I was actually talking with a patient this morning, and we were just discussing how life tends to, you start, you're not able to, crawl or feed yourself and all that stuff. And so you kind of are here, kind of as you age, and then it kind of takes an opposite as we get older. Same thing happens with strength. So when we're younger, we, not a ton of muscle mass, but as we kind of get mature, we develop, our muscle mass, and that peaks, our muscle mass and strength tends to peak in our mid-20s. After that, we maintain that for a period of time, approximately into our 60s. But then from 60 to 80, we have a pretty significant decrease in our muscle mass and strength. So by the time we're 80, we've lost 50% of our strength, and we have 40% less muscle mass, which is a pretty significant amount. So strengthening is going to be very important. So a lot of times patients are like, well, if that's happening, why should I, weight train? I'm just going to lose muscle strength. There is research out there to show that we can slow this progression. So if you properly strength train, and it's kind of the recommended is this progressive overload strength training, which I'll kind of go into, they do see increase in muscle mass and therefore some increase in strength. With that, You'll also see improvements in gait speed. So a lot of times as we get older, you'll see kind of patients, they're shuffling around, and they just don't have the strength. They don't have the strength to kind of push through the floor to take those normal steps that they had previously been able to take. But if we can build some of that strength back, that will help with some of their gait speed. They'll get out of that kind of shuffling gait, which can lead to more fall risk. But it also will help out with activities like getting up out of a chair, or if you're down on the floor and getting up off the floor. So strength training can help all of those activities. So how can we strength train? So this is where I'm going to go over kind of the basics, but the Exercise is Medicine program is a great program and is very important to get you on a program for yourself. I'll go over the basics, but they're very educated in the progress of how to strength train and get you on a very individualized program for yourself. So what are the recommendations? So we want this progressive, overloaded resistance training. So we want to make sure that we're kind of challenging the muscles. A lot of times we tend to underweight things. So as we get older, we don't want to put on that bulk. So we only grab like a 1 pounder when we probably could do a little bit more. So early on, I'll tell my patients, yes, a lighter weight is fine until you're learning kind of the correct form and things, but to actually build muscle mass, we're going to have to add a little more stimulus or intensity to that. So the recommendations, you can kind of see here, this 2 to 3 sets of 6 to 12 repetitions. It's a pretty big range, but it's based off of what you're doing with your the percentage of your 1 rep max, which I'll describe in this next slide. So when we're starting off, I'll tell people you're going to be more in that like lower portion. So you're going to be at like more that 50%, working on more of that form. But with that, you're going to look at higher sets and reps. So you're going to look at more doing like 3 sets of 12 repetitions. But, and like I said, in order to stimulate the muscle and to improve the actual muscle mass and strength, we're going to have to kind of increase some of that intensity. And it's not like you get the, the form down correct, and then you jump right up to 85%. No, it's a gradual, you're kind of working your way up, and it's a variable. It's, you work up some and then you drop back down. So that's where, like I said, the trainers with the Exercises Medicine are very good, kind of educating you on this. Once you can kind of work towards that 85% of your 1 rep max, that's when we're looking at you're going to do more of that 2 to 3 sets of 6 repetitions. So that's kind of, that's what you're going to do when you're going into the gym. And now kind of discussing this next little bucket here is, how do you work the muscles? So upper body, what they recommend is you pick 1 exercise is plenty. If you do another, it's not going to hurt. But 1 exercise is plenty with the upper body to work, for example, say your biceps. So that muscle kind of on the front of your arm here, doing like a bicep curl. Now, when they've looked at the legs, they tend to say lower extremity tends to respond better to like 2 exercises. So for example, the quad, like I said, I feel like it's a very important muscle, especially for that knee health. Looking at doing like a leg press and maybe like a knee extension machine, just to get those 2 exercises to help improve some of that strength in the lower body. And then the recommendations for how many times per week. So in order to build strength, and I've told many of my patients, this is more of a 2 to 3 times a week. As we kind of, you get to a point where you're like, hey, I'm happy, like my strength is good. Maintenance is more like a 1 to 2 times a week, but for building strength, they recommend that 2 to 3 times per week. Okay, make sure I went over all my little notes here. Perfect. All right. So next we're looking at determining our 1 rep max. So this is, when you're younger, it's something you go to the gym, you're, putting on all the weights and determining that 1 rep max. You're trying to figure out, how much weight can you put on there and be able to complete 1 rep. As we get older, that is not something that's safe for us to do. It's a much better, this nice equation here can help us give us that 1 rep max so that you're doing the right intensity of workout. So what you would do is, I'm going to use the bicep just because it's an easy one to demonstrate. You're going to get in, you're going to find a weight. I tell people you don't want to go to the more accurate, the less reps you do with the weight, the more accurate your 1 rep max will be through determining it through this equation. So you're going to go in, you're going to pick a weight that you know you can do at least several reps with. Pick that weight and you're going to go until fatigue. And it's fatigue, I always tell people, is when you can't either lift the weight anymore, or you're starting to, I always say the biceps is a common one, you tend to compensate. So you're kind of using your body to kind of pull that weight up. Once you've gotten the number, so you've got your weight and then how many repetitions you are able to complete, you take it through this equation. So your repetitions you're going to put in here, you'll multiply that times the 2.5, and that will give you a number here. That number you will then subtract 100 minus that number to get B. And then you'll take that number, so B, you'll divide that by 100, and that gives you C. Now you'll take the weight that you started with, or the weight that you used, and then you're going to divide that by the C, that number that you just determined, and that will be your estimated 1 rep max. Okay. All right. So next, what we're going to do is we're going to kind of go into some exercises, and I'll try and kind of have a view. I'm going to kind of go over the slide here, and then I'll demonstrate the exercises as best I can through Zoom, and kind of tell you the things to avoid, things to look for. And if anybody, like Kelly said, if you have questions, please pop that into the chat. So the first one is going to be called, it's a single arm row. So this is a nice one because it's going to work 2 muscles. So you're going to work the muscles kind of in the back of the shoulder, and then again, the biceps muscle here. So I like to tell patients this is a great, so working those muscles kind of through the back are very important muscles. Sometimes as we get older, and a lot of what we do during our day, you're sitting, you're working on a computer, you tend to kind of get this rounded forward posture. These muscles will help kind of keep you more upright. And that's another one that can help kind of with kind of reducing that fall risk as we're kind of hunched forward. That can cause you're not able to see kind of where you're going. And also just you've got your mass kind of forward and can increase that risk for falling. So it's definitely an important muscle to kind of work on, keep you upright. It also can help with preventing some shoulder stuff, because the more we round forward, the more irritation we can get in that shoulder. So with this exercise, what we're looking for is you can bend, like kind of bent over a row or over like a table or a weight bench. You also can do this exercise like lying down off the edge of your bed. So it's more whatever's comfortable. Sometimes I recommend lying on the side of like off the lying on the bed with your arm off the side, because it can help you just kind of stabilize things a little bit more, but not everybody has that ability at home. So bent over on like a bench or a table works just fine. And what you're going to do is you're going to kind of pull your shoulder. So it's going to be kind of this motion here. You're going to pull that elbow kind of back. I always tell people you want to kind of initiate the motion with kind of the shoulder blade kind of pinching down and in, and then bringing that elbow straight back. What we want to avoid is we don't want to see our shoulder come up towards our ear. That can cause some impingement or irritation to the shoulder. So that pinch down and in, and then row back that way. All right. Next is another one that's great because it's going to work 2 muscles, is the chest press. So this one will be a little harder to demonstrate, but I'll do what I can. So chest, we're going to work those pecs. So the muscles up through the front here, and then the triceps here, which I know as we get older, we tend to get that kind of loose skin kind of there. So this can kind of help tone that area up there as well. So this one is, you can do lying on a floor, also as the picture shows, lying on a bench. You're going to have, sometimes people, if they're a little nervous, you can start with just a single arm, just to kind of get the control of it. Make sure you have that other arm just in case, or you can do those 2 arms. And what we're doing is you're going to start in kind of this down position. I tell people if you've got some irritation to the shoulder, you really don't want to take the elbows kind of down past parallel here. That can kind of irritate the front of the shoulder. You can go down a little bit, but just not too far. And then what you're really focusing on is you're going to kind of slowly come and kind of punch out. With all these exercises, you don't ever want to kind of force the movement and kind of lock the joints at their end position. It can definitely, this is where kind of lifting can cause more harm than good. So locking those joints out, we want to stay away from that. So this one in particular, just coming up nice and slow. You want to come to full extension. You just don't want to lock that at the end of the motion. And then as you come back down, just nice and slow and controlled. This is another one we want to focus on. We don't want those shoulders kind of coming up towards the ears, those shoulder blades kind of thinking of keeping those pinched down and in as you kind of punch the arms up and then back down. Now I've got the biceps, which I've kind of gone over a little bit. So it's that muscle that's through the front of the arm here. You can do this one standing, seated. If you're seated, I always tell patients to kind of sit off the edge of the chair so you can take the arm through that full range of motion. So you'll start with them down here, and then you're just bringing the arms up nice and slow, and then controlled all the way down. There are different variations. There's some where you can kind of turn the hands, and my blurred screen's not helping me here, where you can kind of go thumbs up. But just to truly get just that biceps, just coming that straight up and then back down. This one is one that I commonly see people at the gym. They load these weights up too much and they get this full body kind of flinging motion. And I hate to tell them, but they're not really doing a whole lot with the biceps. They're going to be doing a lot more with possibly throwing their back out. Much better to lower the weight a little bit and challenge those muscles, kind of working just the bicep itself. Shoulder press is the next one. So this will work kind of the muscles around the shoulder. This one, if people do have some kind of shoulder irritation, until we get the mechanics right in the shoulder, it would be one that I would not start off right off the bat. So if this one would cause anyone discomfort, I tell them, hey, you just need to hold off on this. There may be some other kind of muscle imbalance that you may need to work on. But if you're able to do it, no discomfort with it, then go for it. So this one, you're starting with the weights kind of here. And then what you're going to do is you're just going to take and you're going to kind of punch those arms up towards the ceiling and then come back down nice and slow. With this one, people will tend to, especially as it gets too heavy, they'll kind of arch their back as they try to punch up, avoiding that because we don't want to cause pain anywhere. And the back is a common area that people have pain. So trying to keep core nice and tight as you punch those arms up nice and controlled and then slowly lower back down. Again, this is another one. We don't want those shoulder blades or shoulders to kind of creep up. We want to keep those nice and pinched down and in as we go up and over the head. Triceps is the next one. So again, working this muscle kind of on the back of the arm. It'll be a similar position that you were in for that row. But instead of kind of bringing the arm up here, the arm stays here and you're just taking that arm back and then slowly kind of bring that arm back down. So this one I'll tell people, make sure core stays nice and tight. And then again, not elevating that shoulder, keeping that shoulder down and just bringing the arm back. We're, this one, making sure we're not kind of flinging the weight and just kind of controlling the motion. So split squat or lunge. This one is going to work the quads, glutes, adductors, and hamstrings. So this one works quite a few muscles. I always say this one gets me more sore than any exercise. So I tell people early on, like a lunge could be, if I can kind of get my camera down here. Early on, I like to tell my patients to do it as more of a split squat, but you can work into doing it more as a lunge. But early on, just getting their feet positioned. And with this, they can hold weights at their side, but I would say get the form down first before you attempt it. So this one, what's gonna happen is this back knee is gonna go down to the floor and then back up. What I don't like to see is kind of that almost, it's called a lunge, but you shouldn't have that lunging forward. This knee, you don't want going over the toe, the other thing you don't want to see is position here. You don't want to see that knee turning in. You want to keep that kneecap facing forward the whole time you're doing the motion. Okay. Next is a bridge. So this is going to work those glutes, hamstrings. And also a nice thing, it's going to work. I usually have my patients activate their core as well. Just kind of works through their abdominal muscles, just kind of work that whole area. They should all kind of work together. So this one, you're just going to be lying on your back. Early on, I say, don't even need to do a weight, just work on the form of it, making sure. So I like to really enforce the importance of the glutes because they're a very lazy muscle. I feel like especially the American population, we sit on these muscles a lot. So they start to think that their purpose is only to be cushioning to sit on. So they forget that they're supposed to actually fire and help us during our day. So with this one, I will tend to have people almost warm their glutes up before they even perform the movement. I will have them lying in this position right here, we call hook line. So they're in that position. They're just going to work on kind of squeezing their bottom together. So just kind of getting those glutes to kick in. Once they've kind of warmed them up a little bit, I'll have them kind of tighten their abdominals, tighten the glute muscles, and then lift the hips up. Once they lift the hips, you can kick those hamstrings in, but we just want to kind of set the system where the glutes fire first, kind of stabilize the pelvis, and then we kind of lift with those hamstrings. And then with this one, just you can place a weight across your hips to add some resistance with this one. Step ups, we're going to work quads and glutes. Again, this one is a great one to work on, as we get older, sometimes we tend to rely on our arms too much to get up out of a chair, off the ground. So this is going to build those leg muscles to kind of assist with that activity. So finding like a box or a step, you're going to step up onto the box. This one you can hold weights on either side. Trying to think of I had a picture of it where it's here. So it would be similar. You just hold the weights kind of at your side as you go to step up onto the box. Knee position on this one is also going to be very important. So as we step up, we don't want to kind of lock that knee as we stand up. We want to go up nice and controlled. We want to keep that kneecap facing forward. We don't want that knee to kind of turn in, kind of like I was talking about with that split squat or lunge. And as we lower back down, really focusing on, as you step back down, not letting that knee kind of come forward. As we step down, we want to kind of have that knee stay in good alignment. Next is a deadlift. So this is going to work some of the back muscles, a little of the hamstrings, and the glutes as well. This one is one that a lot of people are very fearful of. I've got back pain, I can't do this one. Well, oftentimes it's because it's not performed correctly. Most of my patients, what I'll start them with is we've got several foot long dowel rod, and I'll have them place the dowel rod along their spine, because the movement with this one should occur at our hips. It should not be kind of this bending here. It should be a nice curve here. And I would say the hips will kind of go back as we tip forward. I explained some of my patients like a bird bath, and those birds that kind of dip down and back up. That's the motion that we want. With it, you're going forward till you feel, usually the hamstrings are going to be mostly what limits us. Most of us don't have very flexible hamstrings. So you're coming forward till you feel a little stretch in those hamstrings. As you come up, this is where you really want to think, activating those glutes and those hamstrings and not overworking the muscles in the low back, and really coming up nice and straight, utilizing those muscles there. And then lastly, the calf muscles, which I feel like are a muscle that tend to be forgotten about. They're smaller muscles, they're down the lower part of our legs. We don't think how important they are. They're the muscle that is kind of that helps propel us forward. So in running in particular, it's the last muscle that's active to kind of do that push off. Our glutes at that point and our hamstrings at that point have completely shut off. So our calf muscles are what kind of does that final propulsion, which is also what happens in walking. So as we get older, that those calf muscles don't have the strength in them, that's we get into that more of that shuffling gait, and not the shorter strides that can put us at risk for a fall. So calf muscles are very important. With these, you can stand on the ground, you can stand with your feet off the edge of like a step, or if you're at the gym, some people will like have one of the plates down on the floor, and you'll stand with your toes up on the plate, or the like I said, a step. And what you're going to do is you're going to raise up on your toes. What tends to happen with this exercise is people will, as they raise up, they'll kind of go to the outside of their feet. And that's not what we want to do. It's not working the calf muscle efficiently. You want to instruct your patient that they want to keep weight through their big toe as they come up. So as they come up, they're keeping their feet together, not letting those heels kind of come out to the side. And then also just not locking those knees. Keep a little bend in the knees, just to kind of keep protection of the knee joint itself. I tell my patients with this one as well that, you know, you don't think about it, but one calf muscle called your gastroc does cross your knee joint. So most of my knee patients, I will also have them do some type of calf raise, because it's a muscle that surrounds the knee and can help take some pressure or weight off that knee joint itself. All right, that's all I have. I think there's some questions in the box there.
One question there, Melissa. Once you have your number of reps using the formula explained earlier, when is it the right time to either increase reps or increase weight to continue to improve? Great question.
Yeah, great question. So yeah, what I'll tell patients is there's kind of a periodization. So there's kind of a, one thing is you're just trying to, because weightlifting, I'm not huge into weightlifting, but I know it's very important. So I do try to do mine 2 to 3 times a week. But one thing, varying the exercises up can help some with the boredom. So, you know, going into the gym and, you know, maybe one time during the week, you're working on some of that, like the higher reps. So you've got that lower percent of the 1 rep max, and you're looking at that like 3 sets of 12. Well, maybe later in the week, you're working on trying to build that intensity. So early on, yes, you're not going to be at that 85%, but you're starting that lower and you're kind of building up from it. So say you do like 60% one week, and then maybe try like 65, 70 the next week. And this is where like having a trainer kind of help you is very important, because there's kind of a period. So and this is what you do with running as well. You're going to build for several weeks, but then you want to have a week where you kind of back off and kind of rebuild your so with strength training, a lot of people don't realize when you actually strength train, you break muscle down. So the rest portion of the strength training is very important, because that is actually when our muscles rebuild. So that's why when going into the gym, some people they'll do like back and biceps one day, and then another day they'll do like, maybe they'll do a leg day. But that's where kind of that, getting a trainer to kind of help with that whole program is very beneficial. But I mean, you can kind of play around with it yourself, but there should be you almost kind of ramp up, and then you have some kind of a, down week, and then you can kind of build from there. But varying it up is important. And then it's not like you just keep ramping up and then like you work to like 100%. There's also like you would have what we call periodization. So you're doing some training, but then you're kind of having some rest time. And so it's a hard, hard one to answer in like a short period of time, because there's a lot of like science to it.
Great. Thank you so much, Melissa. It was great information for exercising safely to protect our knees and other joints as well. Are there any other questions? If you want to put them in the Q&A or in the chat, we can address those. I appreciate everyone taking some time out of their evening tonight to join us. I hope you'll join us again next month, the first Tuesday of next month. Chelsea Armstrong, one of our exercise specialists, will be with us talking about knowing your numbers and how exercise can affect some of those health parameters, those biometric measurements, or your cholesterol, your blood sugars, your heart rate, your those types of numbers. So please join us next month, and Chelsea will be here to give you all that information. So again, thank you so much, Melissa, for being here tonight. We really appreciate your time and your expertise. So everybody have a great evening.
Thank you.